It is Teleforum. I am Eddy Crow. First hour. Thank goodness Dale Reckless is my guest. See, I'm going to sit here, and this is being live streamed, so if people want to check it out, they can check it out. I love being around anyone that sweats less than me. And today, I think that's what we've got going on. How are you today, sir?
I'm great. Doing great. Yourself?
Well, other than sweating, I'm going to go with sweating like a pig. It's not bad yet. It's going to be rough today, but we're in air conditioning, so we'll get along with it. Something happened to me a couple days ago, and I thought of you. We're always talking about getting dizzy and vertigo and stuff. Mm-hmm. I don't know if I had vertigo or if I'm just too old to be out in ridiculous heat like this. Walking up a flight of steps, I had to stop for a second. So you're going to break that down and explain to me it's just old age and me being stupid, or is it vertigo? Can we talk about that?
Sure, absolutely.
Okay.
Yeah.
What do I need to look for? Here's how it worked. I made it halfway up the steps. I stopped and said, yeah, I'm a little more than usual lightheaded. And then after a couple seconds, I was fine again.
Yeah.
Do I have vertigo now that you have such detailed information?
From that amount of information, I would say you probably do not have vertigo.
Thank you. I'm going to go with that.
That it was probably not vertigo related. And that is a good question, though, because people ask me that a lot when we talk about dizziness and lightheadedness. What's the difference? And is it vertigo? Is it my blood pressure? Is it my heart? Is it something else going on? And one of the very specific factors that differentiates vertigo from other things is it's a position change that causes the spinning sensation. And when people say
position change, that's not me walking. I'm not changing my position by walking up a flight of steps.
It's not. It means like rolling in bed or getting up out of bed or lying down or something like that. It's typically when people experience the cause of vertigo is rolling in bed or something like that. And when people describe it, I usually ask them to tell me about their symptoms without using the word dizzy. And why I have them do that is because I want to try to recognize what the actual symptoms are. Because when you say you're dizzy, it could be multiple different types of sensations that you're having. But what I'm looking for is that spinning type of dizziness. And what I kind of relate it to is, remember when you were a kid and you're on a merry-go-round and you spin around real fast and you get off? And
back when merry-go-rounds were still in the playground before they were whacking people?
They're not in the playgrounds anymore, you're right. But back when you're in the playground, and a lot of our listeners remember the merry-go-rounds that they used to ride on, and you get off the merry-go-round, but you still feel that sensation that things are spinning around you. That's basically the very similar type of sensation that you have with the vertigo. Although vertigo can be a lot more intense than that sensation itself. And sometimes you'll also get nausea sensation with it as well.
Yeah, that queasy stomach thing.
That queasy stomach thing.
Mm-hmm.
You feel like you're going to lose your balance or fall. So if you kind of remember that merry-go-round sensation that you had when you get off of it, you still feel like you're spinning, you feel like you're off balance, feel like you're going to fall, maybe a little nausea with it. That is very similar to what you feel when you have vertigo. And we talked a bit about it last month, and I was very thankful to have Dr. Eric Interval come in and talk with us and be our guest last month as we spoke about it. And he's with the ENT and Allergy Specialists of Western Pennsylvania, which is a fantastic group of ENTs that we work quite closely with. But after that talk, we saw a lot more patients come in for treatment for vertigo. So I think that was a really effective talk last month. If you didn't get to watch it, you can rewatch it on Facebook because it is in the WBVP archives. But the importance of it is I try to promote and talk as much as I can about vertigo because a lot of people don't know, number one, what it is. Number two, they don't realize that we can treat it very effectively at MRS Physical Therapy with our vertigo program that we have. And usually we can fix that vertigo in 1 or 2 sessions. And I've talked to many patients that have come in that have had vertigo and experienced it for a number of years, even sometimes decades. People have suffered with vertigo without realizing that it's something that we can easily treat through our treatment at MRS Physical Therapy and Cranberry Physical Therapy.
What is the logic of them having it for years and not doing anything about it?
I think it's just a lack of awareness, to be honest, and that's why
that's a part of getting older.
Yeah, and that's why I try to talk about it on the radio with my patients. I've had patients that have come in and I'm treating them for something completely different, but in the course of our conversation, it comes up that they have vertigo. And after I realize it's something that they've been experiencing and suffering with, we go into a treatment. And I've had patients as old as in their 90s that have had it for decades, and that we're able to fix it within 1 or 2 sessions. So it's a very effective treatment.
Does that freak them out a little bit in a good way? When somebody's had, I would think, if I've had an ailment for 20 years and I come see you at MRS Physical Therapy twice and it's fixed, I'm looking at you like a holy roller. Does that startle people in the best way? It's
pretty awesome and amazing, but at the same time, it's a little bit frustrating for me because I wish they had come to see me, 10 or 20 years ago, so we could have fixed them sooner, so they didn't have to suffer with it. So that's why I try to talk about it as much as I can with my patients. That's why I talk about it a lot on the radio, so that patients are aware of what vertigo is, number one, and that we can treat it very effectively at MRS Physical Therapy.
Did the treatments that you do now exist 20 years ago?
They did. Yeah, they've been around for quite a while now. But it's something that is very effective that we can really help out these patients with if we can just get them in our doors and have them be aware that it's something that we can easily treat for them.
When they come in with something else, and then this is, I guess, almost like a side diagnosis, is there a connection between the two? Is there another problem that they come see you for, and vertigo might be the underlying
Sometimes, yes. So if someone comes to see us for a balance problem, then I'm always assessing whether vertigo is a component of that. If someone comes in for knee pain or hip pain, it's just through the course of our therapy. Sometimes the patient, I'll be treating them for their knee pain, and they'll lay back and they'll be like, oh, I'm dizzy. Then it'll be my aha moment, like, oh, you might have vertigo. Let's talk about this a little bit more. That's something else that I can treat while you're in, in your therapy session. And they'll be like, oh yeah, I've had this for years, and we talk about it more, and I'll tell them about how I can easily fix it, and we'll, go into a treatment plan for the vertigo, and that'll be, corrected in a couple of visits. Then we'll, refocus back on the original reason why they're coming to see us.
Dale Reckless of MRS Physical Therapy is my guest. This is being live Facebook streamed, and it's always great to talk to Dale. You can listen on all the frequencies. You can watch this. Talk about the treatment plan. I come in and I've got this issue, and you're like, hey, that's probably vertigo. Let's move forward. What's the next step? Yeah,
so there's a number of things I look at with vertigo. It's not just the dizziness, but I look at your ocular motor, which is your eye movements, because sometimes those are off. So I do a test for something called smooth pursuits, which is your ability to track something back and forth.
Sounds like a bad 80s movie title.
Smooth Pursuits?
Smooth Pursuits with Rob Lowe.
Yeah, right.
Okay.
So it's your ability to track something. Yeah, so I'll have you track my finger back and forth with your eyes like that, and I'll be asking you if you have any symptoms of dizziness, waviness, or nausea.
While doing that.
While doing that. Then I'll test you for something called saccades, which is your ability to track back and forth quickly from one point to the other point. So go back and forth, finger to finger. That's called saccades, and that's again same questions. Same questions. I watch your eye movements to make sure they're smooth, because someone that has vertigo might have something called nystagmus, or they might have a little bit of a quivering in their eye movements back and forth. So I assess that with the smooth pursuits as well as the saccades. And then something called the vestibular ocular reflex I test as well, which is your ability to stabilize on one point while your head's moving. So I ask the patient to look at my nose, then turn your head back and forth like this. So while you're rotating your head back and forth left to right, you're trying to focus on my nose, and then I ask the same questions. Do you feel any dizziness, waviness, or nausea? Okay, any of those positive tests can correlate to vestibular issues, and might also be associated with your vertigo. And then I do a test called the Dix-Hallpike test, which is when you turn your head and then you lay back. And that's one of the tests to test for specifically vertigo, specifically for your posterior canal. So you could have vertigo issues in either ear, and any one of 3 canals in either ear. So you have 6 different canals that I'm trying to figure out where the dizziness problem is arising from. So patients that, this happens too. Patients say, well, I Googled this at home and I tried it and it didn't work, which, happens a lot with our patients, and, it's just something we do. We Google everything, right? But it didn't fix it. Well, typically that's because they weren't doing the procedure for the proper canal. So
they were trying to fix the unburned out cylinder.
Yeah, the vertigo could be in any one of 6 canals. So that's one of the evaluation tools that I have that I do with my patients to figure out which ear, which canal the problem is in, and then do the proper treatment for that canal. So the first test I do is called the Dix-Hall Pike, where you turn your head to one side and you lay back. And if patient has active vertigo, they're going to feel spinning dizziness.
That's when the stomach thing would hit, wouldn't it?
They could feel nausea,
Okay.
not all the time, but they could feel nausea. They could feel like they're falling off the table. Sometimes they'll grab for the table or grab to hold on to me because they think they're going to fall off the table because it's so intense. But what I see is I tell my patients I need to keep your eyes open because everything that's happening I can tell by what your eyes are doing. So I watch your eye movements, and typically if you're having an active vertigo episode, then your eyes will be moving back and forth really quickly. Okay, that's called nystagmus. And depending on the direction of the eye movement helps me to know which canal the problem is in.
Really?
So I have to watch your eye movements in addition to doing that procedure to see which ear and which canal the problem's in. So I do it for the right side, I do it for the left side, then I do something called the roll test where I just have you roll onto one side of your body, then have you roll onto the other side of your body. And that is then looking at the horizontal canals. And again, I'm looking at your eye movements, and I can tell if your eyes are moving up and down with that nystagmus quickly, if they're moving up towards the ceiling or down towards the floor. That indicates to me which ear the problem is in.
Is my brain trying to self-correct the problem with the eye movement?
Yeah, so your brain is trying
oversimplified.
Your brain is trying to stabilize things, but it can't because you have something in your inner ear. We call them crystals. Some people call them rocks, and they're essentially stuck. They're supposed to be there. It's not a foreign substance that's in there. They're supposed to be there. They're just stuck in the wrong place. And when they get stuck in the wrong place, it creates that nystagmus, which makes you feel that spinning, dizzy sensation. And that's essentially what we correct. And when we correct it, we use something called the Epley maneuver or the barbecue roll. There's two different things that we do depending on...
It's summer. Go with barbecue roll.
We'll go with barbecue roll.
Yeah.
So depending on which ear, which canal, we'll do the specific procedure to fix that, and it gets the crystals to reabsorb back into the system where they're supposed to go. So it essentially unsticks the crystals and encourages them to go where they should be within the vestibular system, so they're no longer an issue causing that the vertigo.
What causes the crystals to be in the wrong place?
Well, that's a great question, and patients ask me that all the time. And honestly, sometimes we don't know why. But some of the common things are if you had a concussion, recent motor vehicle accident, a blow to the head, maybe a fall, that can cause the crystals to go and get stuck in the wrong place.
Basically scrambled like a snow globe?
Exactly.
In a weird way.
So we use that snow globe analogy because when we shake up that snow globe, those are essentially the crystals, and we're trying to get those through the use of gravity to float into the right place within the vestibular system. That's why our maneuvers are very specific in your body positioning to essentially get the snow globe crystals to go to the proper place within your inner ear. So again, getting back to the reason why it occurs, sometimes we don't know. Sometimes it's just the aging process. Sometimes it just happens as we get older. Sometimes it's a recent blow to the head from a concussion or a fall or a car accident, something like that. It can be caused by being on a recent antibiotic. It can be caused by being on more than 5 medications. Those are some of the common things that we see, but more times than not, we attribute it to just the aging process. It happens to some of us as we age. It doesn't happen to everybody. Sometimes the vertigo goes away on its own, and then it comes back again at some other time. That actually happened to me a number of years ago. I had vertigo, so I've experienced it myself. I knew exactly what it felt like. And my plan was, I didn't want to treat it because I didn't want it to go away, because I wanted to actually film what my eye movements were at the end of the day.
You made yourself a lab rat.
I made myself a lab rat.
Yeah.
So at the end of the day, I went to get ready with my camera to film my eyes and recreate the vertigo so I could use it as a teaching tool for my patients. And I couldn't recreate it again. It had gone away in that time period. So for some patients, it just goes away on its own. I'd say about 50% of the time, it just goes away on its own. And sometimes it'll reoccur again. But for those patients where it continues to reoccur every time they roll in bed or get up out of bed, it happens on a daily basis or maybe every other day, that's when it's time to come and seek treatment from us at MRS Physical Therapy and Cranberry Physical Therapy. Because at that point in time, it's becoming more of a chronic problem that's going to need our treatment to fix it.
Dale Reckless, the MRS Physical Therapy, is my guest. Before we go to news, tell people how they can get in touch with you so they can get treated for this.
Yeah.
I can't believe you were turning yourself. Yeah, actually, I can. You were trying to be. It's like, I'll film myself. That's like some mad doctor. The plutonium's not bad. How do people get in touch with the lab rat that is Dale Reckless?
So we have 2 offices, one in Bridgewater and one in Cranberry Township. The office in Bridgewater is right in the heart of Bridgewater in Stone Point Landing, and that number is 724-728-7550. And then Cranberry Physical Therapy is on Route 19, right in Cranberry Township, right next to North Park Lounge. That number is 591-8121. And you can always email me at d.reckless@mrsphysicaltherapy.com or check out our website at mrsphysicaltherapy.com.
Dale Reckless, my guest. We'll continue talking about me being dizzy after news. It's Teleforum on Beaver County Radio.
It's always the right time to shop the Hopewell Shopping Center, no matter what the season, no matter what the reason. It's truly your neighborhood shopping place with such a large variety of businesses that offer food, shopping, fine dining and quick-serving restaurants, personal services, and recreation. The Hopewell Shopping Center will be your one-stop for everything you need whenever you need it. Just click on beavercountyradio.com, the Hopewell Shopping Center merchant directory, for a complete look of merchants today, and get shopping at your neighborhood shopping place, the Hopewell Shopping Center.
The ballpark is coming into your living room or the dashboard of your car. That's because Pirates Baseball is on Beaver County Radio. Set the dial to WBVP WMBA 99.3 FM or 95.7 FM, and then turn the volume up to hear the most beautiful sound in the world. Pirates Baseball is sure to be a hit this year, and it's presented locally by the Beer Falls Municipal Authority, Express Employment Professionals, Dr. C. Timothy Lipp, Falcones Boone Township Board, Keystone Wellness Program, and St. Barnabas, among others, right here on Beaver County Radio.
Cooler weather, shorter days, and football. It's the season and a great reason to get to Gnu's. While you're watching the games, Gnu's Body Works in Freedom can be restoring your old ride to its former glory. Gnu's specializes in the restoration and customization of all makes and models to make your dream ride a reality. Everything from lowering or airbagging your rod or street custom to full custom paintwork and major and minor body and frame mods. Gnu's also handles collision and general body repairs. Get a real kick out of driving again and get to Gnu's. Gnu's Body Works, 400 8th Street, Freedom. You're listening to Beaver County Radio, 1230 WBVP Beaver Falls and 1460 WMBA Ambridge, broadcasting live from the St. Barnabas studios.
Rodgers and Hammerstein's masterpiece, Carousel, the musical, opens Friday, June 17th at Lincoln Park Performing Arts Center and runs through June 26th. Hailed as the best musical of the 20th century by Time magazine and featuring hit songs such as You'll Never Walk Alone, If I Loved You, and June is bustin' out all over. This magical and majestic classic is a can't-miss piece of musical theater. Tickets on sale now by calling the Lincoln Park box office at 724-576-4644 or by visiting lincolnparkarts.org.
The views and opinions expressed on WBVP and WMBA are those of the participants and host. They are not necessarily the viewpoint of WBVP and WMBA, its staff, management, and advertisers. Thank you for listening to WBVP and WMBA.
Beaver County Radio's news source, 95.7 and 99.3 FM, along with 1230 WBVP, 1460 WMBA, and streaming at beavercountyradio.com. Here's Frank Sparks.
And good morning, as today's forecast is calling for isolated morning showers and thunderstorms. Otherwise, it's going to be mostly sunny, hazy, hot, and humid today. High's going to be up to 94 degrees. There is a heat advisory that will be in effect from 11 a.m. this morning till 9 p.m. tonight, as they are saying heat index values could be as high as 104 degrees. Also recommending that you stay indoors today unless you have to go out. And if you do have to go out, try to limit your activity to early morning or late evening as well. We'll have a complete Beaver County Radio weather forecast coming up right after we have this look at news. Beaver County Radio News correspondent Sadie Giordano is reporting that Ambridge Police, in collaboration with 16 local businesses from 4th to 11th Streets, are providing drink stations to help keep your pets hydrated when walking your pets this summer. You can stop by one of the following businesses: the Older Genius, the Chapel Thrift Shop, Lickety Splits, Stangle's Bakery, Off the Hook, Vape Roll With It, the Dollar General, Heritage Floral Shop, Merchant Coffee, New Alliance Federal Credit Union, God's Fields Outreach Ministry, Bridgetown Tap House, 8th Street Sunoco, the Huntington Bank, Little Athens, and Tom's Old Country Store. Now, if there's any other businesses that are interested in bowls to set up a drink station for pets, you can call 724-266-5977, and one will be delivered to you. Police will visit businesses on Duss Avenue and Church Street in the near future to deliver the bowls to the businesses that chose to participate. A thank you is extended to everyone that is participating in keeping our furry friends safe and healthy this summer. Pennsylvania State Representatives Josh Kell, Torrin Eckert, and Tim O'Neill noted yesterday that an incredible outpouring of support from the public and fellow members of the Pennsylvania House of Representatives in efforts to ensure the laws are enforced in Philadelphia by the willful misconduct of District Attorney Larry Krasner. The trio said via release, in the 24 hours since we announced our intention to file the articles of impeachment against Philadelphia District Attorney Larry Krasner, there has been an outpouring of support and helpful information submitted to the website stopkrasner.com. We are also pleased that many members have already signed as co-sponsors for the forthcoming articles of impeachment. On Monday, Pennsylvania Senator Democrats made a motion for the Senate to vote on a discharge resolution that would move Senate Bill 134 out of committee and to the floor of the Senate for a full vote during session. State Senate Republicans blocked the resolution with a unanimous no vote. Senator Wayne Fontana from Allegheny County, who's the author of the legislation, expressed frustration and disappointment in the inaction by their colleagues on the other side of the aisle.
Isn't this timely and appropriate right now in Pennsylvania and all through our country to bring up a bill like Senate Bill 134, which is the Extreme Risk Protection Order bill? This bill isn't about taking guns away from anybody that shouldn't have them. I mean, if you're a law-abiding citizen, that's fine. But if you're someone that's mentally ill, that has issues, why shouldn't there be a process to take that gun away?
Now, the audio is courtesy of Senator Fontana's office. President Joe Biden is calling on U.S. oil refiners to produce more gasoline and diesel. In a draft letter to refiners, Biden says their profits have tripled during a time of war between Russia and Ukraine as Americans struggle with record high prices at the pump. Biden writes that the oil companies need to work with his administration to bring forward near-term solutions that would address the crisis. Gas prices nationwide are averaging roughly $5 a gallon. That's an economic burden for many Americans and a political threat for the president's fellow Democrats going into the midterm elections. Biden's message that corporate greed is contributing to higher prices might resonate with voters.
Here's the Beaver County forecast on 95.7 and 99.3 FM, along with 1230 WBVP, 1460 WMBA, and streaming at beavercountyradio.com.
There's a chance for an isolated shower or thunderstorm sometime this morning. Otherwise, it's going to be mostly sunny, hazy, hot, and humid. High's going to be 94 degrees. There is a heat advisory in effect from 11 a.m. this morning till 9 p.m. tonight. Heat index values could be as high as 104 degrees. They are recommending that you stay indoors today in the air conditioning, but if you do have to go outside, try to keep your activity to the morning time or the evening. And if you do need to go out and do some type of activity, make sure you stay hydrated. Otherwise, overnight tonight, a chance of showers and thunderstorms mainly towards morning, low down to 74 degrees. Afternoon showers and thunderstorms likely tomorrow after 5 p.m. with a high of 92 degrees. That'll set us up for a beautiful weekend. Friday, sunny skies, high 83. Saturday, sunny and a high of 72. And then Sunday, mostly sunny with a high of 75 degrees. That is a look at the news for now. I'm Frank Sparks, Beaver County Radio News, 95.7 and 99.3 FM, presented by St. Barnabas, 1230 WBVP, 1460 WMBA, and beavercountyradio.com. You're listening to Beaver County Radio, 1230 WBVP, Beaver Falls, and 1460 WMBA Ambridge, broadcasting live from the St. Barnabas studios.
1230 WBVP, 1460 WMBA, 99.3 FM, presented by St. Barnabas, 95.7 FM, live streaming at beavercountyradio.com, live Facebook feed at the Beaver County Radio Facebook page, and the free app. Dale, you are everywhere. Dale Reckless of MRS Physical Therapy is my guest. We were talking about vertigo. The list of opportunities that I just ran down made my head spin. That's not the same as vertigo, is it?
Not the same. No.
That's my own doing, isn't it?
That's your own head spinning, yep.
Okay. I had asked you before what we were talking about, the crystals in your ear and them being out of place. And you were blunt and honest, and from a medical professional, it stood out. You said sometimes we don't know what moves those crystals in the canals. Are we better at it than we were 10 years ago? Because you've been doing this for a while. You've been treating vertigo patients. How have the treatments improved since you've been dealing with it?
Yeah, I think we are better at it. And to kind of review again, it's okay that we don't know why it happens because it doesn't affect how we treat it. We still treat it very effectively, whether it's from a concussion, whether it's from being a recent antibiotic, or whether it's just the aging process. We treat it the same way. And there's been a bunch of research that's been done over the years that kind of pinpoints how to do the treatment and what you should and shouldn't do after the treatment. And a lot of what's changed over the years is our understanding of what you should and shouldn't do after the treatment. Where years ago we thought after treatment you should, limit your mobility. So if you were treated for vertigo 20 years ago, your therapist might have told you to stay sitting up in a chair for 2 days, or wear a neck collar, or don't move side to side.
Really?
And we've realized through our research that no longer stands up as far as things you have to do. So now I tell my patients after their treatment they don't have to do anything different at all. At most, if they have an episode of vertigo, I just tell them make sure they sit at the edge of their bed before they try to get up and walk anywhere, because when you're having an active bout of vertigo, you are at a higher risk of falling. Mm-hmm. And I've had patients, and I've heard stories about people trying to get up too quick and get to the bathroom because they thought they were going to be sick, and then falling on the way to the bathroom and then hitting their head off the toilet and knocking themselves out and giving them a concussion on top of having the vertigo.
Which can lend to the crystals being out of place even
causing
worse.
even more problems, right? So, so at most I tell my patients when they get up and they feel that dizziness, just stay where you are. The dizziness usually settles down within a minute or two, and then they can get up and slowly move around through the course of their day. But we don't want that either. We want them to be able to get up and move around quickly and do their normal daily activities, and that's why it's so important to treat the vertigo, not just to live with it. So the patients that come to me and have been living with it for a while, they'll tell me, well, what I do is I just make sure I sit up and I sit there for a minute before I get up. But you really shouldn't have to do that. We can treat the vertigo so you don't get dizzy anymore, so you're not at a risk of falling anymore. And usually we can fix that in 1 or 2 sessions. It's usually a really quick, effective treatment. It's probably the most effective treatment that we do at MRS Physical Therapy as far as outcomes going, meaning if you come in to see us, if we can fix you in 1 or 2 visits, that's fantastic. You're out the door, you're gone, and you may not ever have to come back again. People ask me that as well. Is this vertigo going to come back? Mm-hmm. Sometimes it does, but it's a small handful of people. I would say less than 5% of the people have recurrences of the vertigo. Most of the time the patients are on their way. I don't see them again for that symptom. They might come back for some other reason, but not for the vertigo. But there is a small handful of people that will come back once or twice a year because the vertigo is recurrent. But the good news is this time they know they just come to see us, they're going to be fixed in 1 or 2 sessions, and they don't have to come back again for 6 months until it reoccurs again. But again, most of the time it doesn't reoccur. Once we fix them in that 1 or 2 visits, they're good to go, and they don't have another problem with it.
Is vertigo something that's going to show up out of nowhere and startle me, or do I get hints a little at a time?
It shows up out of nowhere and startles you. And a lot of patients, they're initially thinking, oh my gosh, am I having a stroke? What's going on with me?
Lightheaded, something
serious wrong. A lot of patients
right.
end up going to the ER because of it, because it can be so significant, the dizziness. Sometimes you have nausea to the point of actually you throwing up. Mm-hmm. It can be very severe. And by all means, if you feel like you need to go to the ER for it, you should, just to rule out that you're not having a stroke or other symptom like that.
Yeah.
But for patients that have been diagnosed with vertigo, they usually know right away that because they've had it previously and we fixed it previously, they know what it feels like, they know that we're going to take care of them, so they just come back to see us without going to see the doctor first or going to the ER once they've established and understand what that vertigo is.
Is vertigo growing? And if it is it growing because more people are getting it, or because more people recognize it for what it is?
I think I'm seeing it a lot. I wouldn't call it growing, but I'm seeing a lot more of it for a couple reasons. One, because of the aging population, and I do believe that just the aging process is a component of why people get vertigo. Number two, I think we're doing a better job at talking about it and understanding what it is and that we can treat it. So I'm seeing more patients because people realize and understand that we can quickly and effectively treat it at MRS Physical Therapy and Cranberry Physical Therapy. Without needing medications, without needing to deal with it for years. That's another thing we should touch on, is there is a medication called antivertameclazine that people take for it.
What? Go run that one again?
It's called Antivert.
Antivert, I got.
The other name for it is called Meclazine.
Antivertameclazine.
And that's a medication that some people take, but all that medication does is it doesn't fix the problem, it just suppresses the symptoms. So it suppresses the symptoms so you don't feel it, but it has side effects of making you drowsy. So I've had
so
patients.
You're not dizzy, but you're drowsy.
Now you're drowsy, so you're not feeling great because you're tired all day.
Right.
So I'm not a big fan of that medication for that reason. I don't like that side effect of my patients feeling drowsy through the day. So I prefer to fix the vertigo instead of suppressing the symptoms with the medication, which is all meclizine does. And so the patient no longer has to take that medication after we fix them.
How often does that happen if somebody comes in and said, I don't want treatment, do you have a pill?
All the time.
Does it?
Yeah, but I educate the patient so they understand that this meclizine or antivert that they take, it's not going to fix the problem. It's just going to suppress it. It's not going to make it go away. And who wants to take medication the rest of their lives, really, right? Especially if it has the side effect of making you drowsy. But I do see that on a regular basis where patients say, well, I've been taking this meclizine for it, and I take it for years. But the vertigo never goes away because meclizine doesn't fix the problem. It just suppresses it. So what we want to do at MRS Physical Therapy and Cranberry Physical Therapy is fix the vertigo problem so they don't need to take the medication. You can get up and roll in bed without getting that dizzy sensation. You're not at risk of falling when you get up because you don't have that spinning sensation. So that's what we do to take care of that problem.
Are there people that medicine is the better option?
There are some patients that get such severe vertigo that I tell them that, if you get it really bad and you need to take it because you're sick to your stomach, you're going to throw up, then by all means take it. It's a small handful of patients that I do say, keep it on hand in case you need it for emergency situations. Okay. But again, that's not the long-term goal for us. Our goal is to fix that vertigo, so it's no longer a problem.
Doesn't that add to the problem? Because you mentioned earlier you can get vertigo if you're taking a bunch of medications? Or that you were talking about 5 medications?
More than 5 medications.
Okay. Isn't that adding? Aren't you suppressing the problem while potentially adding to the problem?
Yeah, and what meclizine also does is if patients have recently taken it while I'm doing my initial evaluation, it makes my evaluation a little bit more challenging to figure out where the canal and which ear it's in, because if you're not having an active vertigo, it makes it more challenging for me to diagnose, which ear and which canal the problem's lying in. So, it kind of gets in the way a little bit that way. It gets in the way, as far as, taking another medication. It is something I try to discourage my patients to take while I'm treating them, because I want to see what's actually going on with them instead of having some medications in their system that's kind of swaying what their symptoms are.
It could give you it's like a tainted diagnosis.
It could give me a false negative for their diagnosis.
You've done this for a while as a society, just your patients. Are we seeing people more willing to get therapy over meds, or are we still a take a pill, make it better society? And you're swimming uphill against that.
I think we're starting to see more the improvements of people trying to take care of things without medications. I think our normal go-to is wanting to take a medication to fix things right away.
Take a pill.
Take a pill. But I think we're starting to see an improvement in a direction that I think we should go as a society with taking care of the problem without the medications, because the medications have so many side effects. And we've seen that with a lot of the pain medications, and the doctors have realized this over the course of the last couple of years, that it's more important for a patient to fix the problem than for them to be on a medication that's covering up the problem and causing more other systemic issues with the rest of their body. So.
And you think this is growing, but we're doing a better job of getting people aware of it?
We're doing a much better job of getting people aware of it, and that's one of the big things that I like to do this radio show for the listeners and those watching on Facebook Live.
It's not to come in and watch me sweat?
No, that's probably very low on my priority scale, to be honest.
You know what? If it was any higher than that, we'd both have issues. I appreciate that. Getting the word out is what we're talking about.
Getting the word out, that's one of the great things about this radio show, is getting the word out so people understand what we can do at MRS Physical Therapy and Cranberry Physical Therapy with treating vertigo and all the other problems that people come to see us for. But I would say vertigo is probably at the top 3 of the list of things that people are not aware of that we can help out, and that's why I talk about it so much. I'd say so vertigo, and probably TMJ is in the top 3 as well. As far as
it's not lockjaw, something to do with the jaw.
It's similar to that. So
okay.
with TMJ, you usually have pain in your jaw. You can have it on one side or both sides of your TMJ joints. You usually get pain with chewing. Sometimes you get clicking in the jaw. Sometimes you get headaches associated with it. Sometimes your jaw gets stuck open. where you can't close it. Sometimes it gets stuck closed. More often than not, it gets stuck closed where you can't open it far enough. So you'll notice you can't open up your mouth far enough to yawn, or it's painful when you yawn. You can't open up your mouth far enough to brush your teeth. You can't open up your mouth far enough to eat a permani sandwich, that kind of thing.
Oh, wow, that's bad.
Yeah, right. So it's devastating for some of us that like our Pittsburgh sandwiches. Normal opening, you should have about 40 millimeters of opening. So if you're at home, you should be opening your mouth about 40 millimeters, which is about a couple knuckles inside of your mouth.
Like that?
Yep. So if you can't open up that far, usually it's symptomatic where you notice you can't brush your teeth, it hurts to yawn, or you can't open up far enough to eat a sandwich.
I could do almost 3, Dale.
Well, some people have hypermobility issues, which means they can open up their mouth too far, and then they become talk show hosts.
Like, no doubt. or snakes.
Right. But most of the time, people can't open up their mouth far enough, and that's an issue for them, for hygiene, for brushing their teeth, for eating. They can't eat a sandwich. They have problems that it hurts when they chew. They can't eat the foods that they want to eat, and they come to see us for TMJ issues, and we can fix that by increasing their mobility, increasing their flexibility of their TMJ joints.
Are you with what?
Decreasing
jaw
their pain.
Exercises?
Yes, we have jaw exercises.
Okay.
So we use modalities to help to decrease the pain. So we use some heat and something called microcurrent stim, which is a low-level stim that you really can't feel, but it helps to decrease the inflammation and decrease the pain in the jaw joint. And then we do specific exercises. We do manual hands-on things with our patients. We do soft tissue massage to the muscles outside of the mouth.
Okay.
As well as with a glove on our hand, we stick the fingers in a finger inside of the mouth to work to access the muscles that are inside of the mouth that have gotten tight.
How many times you been bit?
Once.
Once? Okay.
And I've been doing this a long time, so that's a pretty good record.
Okay.
But really, you're keeping your fingers outside of the tooth area. So you're just working on the soft tissue muscles back in there and relaxing those. And then we do something called joint mobilization, where I put my thumb on the lower part of the teeth and I move the jaw joint up and down with little small motions, barely even palpable, to loosen up that TMJ joint a little bit, especially when people can't open up far enough. That helps to loosen up the TMJ joint so they can open up far enough so they can eat again or yawn without pain or brush their teeth without pain. So TMJ is probably, between TMJ and vestibular, those are the top 2 things that people aren't aware of that physical therapy can help out with. Yeah. Specifically our programs at MRS Physical Therapy and Cranberry Physical Therapy, because not all physical therapists do vestibular and TMJ therapy.
And what was the third thing that you see? Because you mentioned there are 3 things. One's the vertigo and then TMJ. What else do you see a lot of?
So our neurological program, specifically with our Parkinson's program, is something we see a ton of because of our programs with Parkinson's. We have 2 support groups for Parkinson's, one in Beaver County, one in Butler County. So we have a lot of patients that are, we probably have 15 or 20 people that attend those monthly support groups, but we also have a specific exercise program for people with Parkinson's. And Parkinson's, there's a lot of people with Parkinson's in Western Pennsylvania, and we're not exactly sure why, but there's definitely a demographic of a high Parkinson's population in this area. And it's something that we have a very specific program called LSVT Big. And not a lot of people, not a lot of people are certified to do LSVT Big. You have to go through an extensive certification program in order to do the LSVT Big program, and not a lot of people in Beaver or Butler County are certified to do it, but it is something that we specialize in to work with people with Parkinson's disease.
What is Parkinson's disease?
So symptomatically, what you see with Parkinson's disease is you see people with shuffling of their feet.
Short steps,
shuffling feet. You also see them walking with decreased arm swing, sometimes on one side, sometimes on both sides. And you see their posture starts to pull forward. Their head pulls forward, their shoulders pull forward. So usually if I'm sitting in the park and I'm just watching people, I could literally tell if someone has Parkinson's by watching their symptoms. I can tell by their movement patterns. It's usually a smallness of movement, so their movements have gotten smaller and their movements have slowed down. And it's those very 2 particular symptoms that we can effectively treat with our program at MRS Physical Therapy and Cranberry Physical Therapy. That smallness of movement and that slowness of movement we can effectively treat through the LSVT Big program. So when you see someone walking or you start to see them shuffle their feet more, maybe your spouse at home, you've noticed that. Their step length has become shorter. They're starting to shuffle their feet instead of lift up their feet. Maybe they're starting to fall a little bit more frequently. Maybe you see them leaning forward a little bit more frequently. Sometimes you'll see a tremor in their hand, which may or may not be Parkinson's. Usually see something called micrographia, which means your handwriting bleeding becomes smaller. So your signature becomes smaller and smaller. That's a very common symptom with Parkinson's. That's called micrographia.
And that you're not even aware of that. That's
and sometimes you're not even aware of it.
Okay.
Many times the patient's not aware of it. They feel like their brain is telling them that their movements are normal, but they're not. So it's usually a caregiver or a spouse that notices the changes versus the patient themselves that notice the changes. Because the brain is thinking that these are still normal movements, but they're not normal anymore. They're becoming smaller and slower. So it's usually a caregiver or someone else that recognizes that first and identifies it and calls up, the neurologist, the movement specialist that works with Parkinson's disease to get an evaluation. And that neurologist will diagnose them with Parkinson's or not with Parkinson's. Usually the best identifier is if they put you on a medication called carbidopa-levodopa, and that improves your symptoms.
That sounds like a made-up word. That sounds like Ubba-Dubby from Zoom or something the Swedish chef would say. Say that name again.
Carbidopa-levodopa is the medication. And when you're on that medication, if your symptoms improve, then it's Parkinson's that you have. If it doesn't improve, if there's no change in your symptoms, then they start to look at other diagnoses as possibilities for causing the symptoms that you're having. Usually those symptoms are they're very easily seen. You have difficulties with opening and closing your hands like this, or you have difficulty pinching your thumb and index finger together like this, or you have difficulty with these kind of alternating movements with your hands up and hands down.
Okay.
You'll see one side is slower or more difficult to move than the other side. Those are the motor symptoms that we typically see with Parkinson's. But your neurologist will go through a full series of tests to diagnose you, in addition to trying out the medications to see if that help as well. But the good news is that we can treat Parkinson's with our therapy programs that we have at MRS Physical Therapy and Cranberry Physical Therapy. And we also have great social networks through our support groups with other people that have had Parkinson's, caregivers that are supporting people with Parkinson's. The support groups are very positive support groups. The people love going to them because they can see other people and talk to other people that are going through the similar things. The caregivers are able to talk to other caregivers that are helping to work with the patient, with their spouse or loved one that has Parkinson's. So they're very positive support groups that we have in the Beaver County and Butler County areas that we have for our patients.
How often does it happen? Somebody comes in and says, okay, my neurologist says I have Parkinson's. Do you have a pill for that?
Well, the doctor's already talked to the patient about that.
So they've already had that talk.
And there is a medication that helps out with your symptoms. So that is a diagnosis that medication is very important to help out with the symptoms. But medication alone is not enough. And the neurologists will tell you the number one thing to do for Parkinson's is exercise. And that's what we train our patients, is how to exercise appropriately for your Parkinson's diagnosis. And I talk about this with a lot of my patients for different symptoms, for their different diagnosis, is dosage of exercise is just like dosage of medication.
Okay.
So when you have a dose of medication, you have to take the right amount. If you take too little, it's not going to help you. If you take too much, it's going to hurt you. So exercise is the same way. You have to find the right amount of dosage of your exercise to help out your Parkinson's or your multiple sclerosis or your knee problems. If you're not doing the right exercises, that's a problem, right, of course. But dosage is even more important. If you're doing too little of the exercise, meaning not enough reps or not enough resistance or whatever it might be, it's not going to help you out. If you do too much, it's going to hurt you as well. So what our goal is to find the right dosage with our patients, particularly for Parkinson's diagnosis, sometimes for MS and the other diagnoses as well, but to find the right dosage of the exercises that's going to help you out without hurting you and without being not enough to help you. So that could be the number of reps, the proper exercise, the amount of resistance is very important for us to help out with our Parkinson's patients.
The majority of the patients that get it wrong, do they get it wrong on the not enough exercise, or do they get it wrong on the you're doing too much, dial it back?
For Parkinson's, the majority is not enough.
Okay.
For other diagnoses, it's very easy to do too much. So multiple sclerosis is one of those diagnoses that we specialize in, that patients can often do too much. And when you do too much with multiple sclerosis, it wears you down. It fatigues you quicker. So you have to find the right number of reps and the right amount of resistance and the right exercises for MS very specifically so they don't overdo it. For Parkinson's, usually they're underdoing it. They're not doing enough. And we have to push them a little bit harder and give them a good variety of exercises that they enjoy and they appreciate, because if you don't enjoy your exercise program and see the benefit, you're not going to do it.
Right.
And honestly, we can teach you, every day for a month, but unless you continue with these exercises through the course of your life, it's not going to help you out. And Parkinson's is a lifetime diagnosis. Once you're diagnosed with it, there's no cure for it.
Right.
Just like MS, there's no cure for it at this point in time. But with the right medication dosage and the right exercise dosage, you're going to get your best outcome. You're going to extend the quality of your life for improvements if you have the right dosage for exercise that we provide at MRS Physical Therapy and Cranberry Physical Therapy.
Dale Reckless is my guest. What should I have asked you about any? Because we talked about vertigo and we talked about Parkinson's. We talked about a lot. What should I have asked you today that I didn't?
Well, just let me tell the audience again how to get a hold of us. Keep in mind we have something called direct access license, which means you don't need to go see the doctor first before you come to see us, especially
Nice.
for things that are minor. You know, if you have plantar fasciitis, just come in to see us. You don't need to see a doctor first for that. So if you have something minor that we can take care of, you can just come to see us through the direct access license. So just call us at for our Bridgewater office, which is in the heart of Stone Point Landing. That number is 724-728-7550. And the Cranberry office, that number is 724-591-8121. And always feel free to email me. That is d.reckless, which is RECKLESS at mrsphysicaltherapy.com. You can check out our website, which is mrsphysicaltherapy.com, which has all good information on it. It's a lot easier than a Google search because it's going to direct you towards some simple exercises, some understanding of your diagnosis the doctor might have given you, things that you can do to help yourself out with your physical diagnosis at mrsphysicaltherapy.com. So, you know, we'd be happy to help you if you're having any issues with TMJ, vertigo issues, plantar fasciitis. We treat all ages, so we treat from birth all the way up through the age that you are now, and we treat all diagnoses. So, and we also take most insurances as well, I should mention that. So there really aren't any insurances that we don't take. I really don't like to turn anybody away. Anyone that needs our care, I like to provide our care. So don't let that be a block for you coming to see us. Your insurance, should be fine to come see us as well. So,
Dale, I'm going to spend the rest of the day putting my knuckles in my mouth. Now, you're an expert. You're a professional. 3.
Yeah,
I'm a healthy talk show host mouth.
You're a healthy talk show host mouth.
Dale Reckless from MRS Physical Therapy has been my guest. It's Teleforum with a healthy talk show mouth on Beaver County Radio.
The ballpark is coming into your living room or the dashboard of your car. That's because Pirates Baseball is on Beaver County Radio. Set the dial to WBVP WMBA 99.3 FM or 95.7 FM, and then turn the volume up to hear the most beautiful sound in the world. Pirates Baseball is sure to be a hit this year, and it's presented locally by the Beer Falls Municipal Authority, Express Employment Professionals, Dr. C. Timothy Lipp, Falcones Moon Township Board, Keystone Wellness Program, and St. Barnabas, among others, right here on